Turning 60 is a milestone that often brings with it a sense of accomplishment and wisdom. It's a time when many men reflect on their journey, cherish the memories they've made, and look forward to more years with family and friends. But with this new chapter also comes a heightened awareness of health, especially when it comes to issues that are unique to men. One such concern is prostate cancer, a topic that can be daunting, confusing, and sometimes even a little frightening. If you're a man over 60, or if you care for someone who is, understanding the symptoms of prostate cancer could be one of the most important things you do for your health and peace of mind. Prostate cancer is the most common cancer among American men after skin cancer. Its risk rises significantly after 60, making this age group especially vulnerable. But here's the thing. Prostate cancer doesn't always announce itself loudly. It can be subtle, creeping in quietly and slowly. That's why recognizing the symptoms and not dismissing them as just getting older is so crucial. Early detection can make all the difference, and sometimes it's the smallest changes that matter most. So, what exactly is the prostate? It's a small walnut-shaped gland located just below the bladder and in front of the rectum. Its primary job is to produce seminal fluid, which nourishes and transports sperm. As men age, the prostate often grows larger, a condition called benign prostatic hyperplasia, BPH. But this isn't cancer. Sometimes the symptoms overlap, and that's where things get complicated. Distinguishing between normal aging and something more serious is the first step toward taking control of your health. Let's start with the most common symptoms of prostate cancer in men over 60. One of the earliest and most frequent signs is difficulty urinating. You might notice a weak or interrupted flow, or find yourself straining more than usual. Some men feel like they can't completely empty their bladder, while others experience a sudden urge to urinate, especially at night. You may be waking up several times to go to the bathroom, disrupting your sleep and leaving you tired during the day. While these symptoms can be related to benign conditions, they shouldn't be ignored. If they persist or get worse, it's time to talk to your doctor. Another symptom to watch for is blood in the urine or semen. This can be alarming, and while it's rare, it's a sign that needs immediate attention. Blood can indicate that something is wrong inside the prostate or elsewhere in the urinary tract. Don't brush it off. Getting checked can help you catch problems early. Pain is another potential warning sign. Some men experience discomfort or pain in the pelvic area, lower back, hips, or thighs. This pain can be dull and persistent, or it may come and go. It's easy to attribute aches and pains to aging or old injuries, but if the pain is new, unusual, or won't go away, don't ignore it. Erectile dysfunction, or difficulty maintaining an erection, can also be linked to prostate cancer, especially if it develops suddenly. While sexual health changes with age, abrupt changes should prompt a conversation with your healthcare provider. Similarly, if you notice pain during ejaculation or a decrease in the amount of semen, these could be signs that something isn't right. Some men experience swelling in the legs or feet, which can be caused by a blockage of lymph fluid, a possible sign that prostate cancer has spread. Bone pain, unexplained weight loss, and extreme fatigue are also symptoms of advanced prostate cancer. These signs are less common in the early stages but are important to recognize. Now, let's talk about why these symptoms matter so much after 60. The risk of prostate cancer increases as you age, and men over 60 are more likely to develop aggressive forms of the disease. Genetics play a role too. If your father, brother, or uncle had prostate cancer, your risk is higher. African American men also face a greater risk and tend to develop more aggressive cancers. Knowing your family history and talking openly with your doctor about your personal risk factors can empower you to make informed decisions. But here's the emotional reality. Many men hesitate to discuss these symptoms. It's easy to feel embarrassed or worried, or to think that these changes are just an inevitable part of getting older. Some men delay seeking help because they fear the diagnosis, or they're concerned about the impact on their sexuality and masculinity. It's understandable. These are deeply personal issues, but ignoring symptoms can lead to worse outcomes, and taking action is an act of strength, not weakness. This is where having honest conversations with your healthcare provider comes in. Routine screenings like the prostate-specific antigen, PSA, blood test, or a digital rectal exam, DRE, can help catch cancer early, often before symptoms appear. If you're over 60, Talk to your doctor about how often you should be screened. The recommendations may vary based on your risk factors, family history, and overall health. It's also important to remember that prostate cancer doesn't always mean surgery or life-changing treatment. Many cases are slow-growing and can be managed with active surveillance, where your doctor monitors the cancer over time. Other cases may require treatment, such as radiation, hormone therapy, or surgery. Advances in medicine have made these treatments more effective and less invasive than ever before. The key is catching cancer early and making decisions based on your unique situation. Let's pause for a moment and think about the emotional journey this can be. For many men, the possibility of cancer brings a wave of anxiety, uncertainty, and questions about the future. You may worry about your family, your ability to enjoy retirement, or your independence. It's natural to feel vulnerable, but you're not alone. Millions of men have faced this challenge and come through it stronger, wiser, and more appreciative of life. Support is vital. Talking with your spouse, children, friends, or support groups can help you process your feelings and make sense of your options. Sharing your story can be cathartic, and hearing from others who have been through it can give you hope and perspective. There's strength in community, and no one should face this journey in isolation. Lifestyle plays a role too. Eating a healthy diet, staying active, and maintaining a healthy weight can help lower your risk and support your overall well-being. Some studies suggest that diets rich in fruits, vegetables, and healthy fats, like those found in fish and olive oil, may protect the prostate. Regular exercise improves circulation, energy, and mood, and helps you feel more in control. But while prevention is important, the reality is that cancer doesn't always play by the rules. That's why being proactive about symptoms is so essential. If you notice changes in urination, sexual function, pain, or unexplained weight loss, don't wait. Your doctor can help you sort through what's normal and what's not. And together, you can develop a plan that's right for you. Let's take a moment to acknowledge the courage it takes to face these questions. It's not easy to talk about symptoms that feel private or uncomfortable, but your health is worth it. Your family, your dreams, your plans, they all depend on you being proactive and informed. The truth is, many men survive prostate cancer and go on to lead full, active lives. Early detection gives you the best chance. Consider the story of a man named Richard. At 65, he started noticing he was getting up 3 or 4 times a night to urinate. At first, he shrugged it off. Getting older, he thought. But when it started affecting his sleep and energy, he mentioned it to his doctor during a routine checkup. His doctor recommended a PSA test and a follow-up exam. The results showed early-stage prostate cancer. Because it was caught early, Richard had several treatment options. And with the support of his family, he chose a course that worked for him. Today, he's cancer-free, traveling with his wife, enjoying time with his grandchildren, and grateful that he listened to his body and spoke up. Richard's story is a reminder that you are the expert on your own health. You know when something's off, even if it's subtle. Trust your instincts. If you're over 60, pay attention to changes, however small, and don't hesitate to reach out for help. Your story could be one of hope, just like Richard's. Let's recap the key symptoms of prostate cancer in men over 60. Difficulty urinating, weak or interrupted flow, frequent urination at night, blood in urine or semen, pain in the pelvic area or lower back, erectile dysfunction, pain during ejaculation, swelling in the legs or feet, bone pain, unexplained weight loss, and extreme fatigue. These symptoms can overlap with other conditions, but they are signals that deserve attention. Remember, prostate cancer is common, but it's also treatable, especially when caught early. Screening tests like the PSA and DRE can help detect cancer before symptoms appear. If you have a family history of prostate cancer, are African American, or have other risk factors, talk to your doctor about personalized screening recommendations. Taking charge of your health at 60 and beyond isn't just about living longer. It's about living better. It's about being present for the moments that matter, whether it's fishing with your grandson, celebrating a wedding anniversary, or simply enjoying a quiet morning with a cup of coffee. Health is the foundation for all these experiences, and protecting it is one of the greatest gifts you can give yourself and your loved ones. So, what can you do right now? First, stay informed. Educate yourself about prostate cancer symptoms, risk factors, and screening options. Second, Listen to your body. Don't ignore changes, even if they seem small or insignificant. Third, talk to your doctor and ask questions. Advocate for yourself. Fourth, support others on this journey. If you have friends or family members who are hesitant to talk about their health, reach out and share what you've learned. Finally, prioritize your well-being. Eat well, stay active, and make time for the things you love. Before we close, I want to thank you for taking the time to learn about this important topic. Your health matters, and every step you take brings you closer to a future filled with possibility and hope. If you found this information helpful, please subscribe for more content about men's health, aging, and wellness. Leave a comment below to share your story, ask questions, or connect with others. And don't forget to share this with someone you care about, because together we can raise awareness, support each other, and make a difference. Remember, prostate cancer doesn't have to be a silent threat. Knowledge is power, and early action saves lives. Take care of yourself, stay vigilant, and keep moving forward, because the best years may be yet to come.